experts are warning that South Africa is heading for a peak in COVID-19 cases after the country saw the biggest jump in a day last Thursday, recording 3,267 new COVID-19 cases. Now, the newly appointed DG of Health started his job just as the country entered level 3 of the lockdown. He's had to hit the ground running as provinces are battling with a shortage of test kits, testing backlogs and ventilators, to name just a few challenges. So what is the Department of Health planning to do to continue fighting the pandemic as we now head into relaxing regulations? Well, the newly appointed DG of Health, Dr. Sandile Buthelezi, joins us now to unpack this more. Dr. Buthelezi, thanks very much for your time this morning on the AM report. It's rather worrying for those of us who are looking at these statistics. You know, the positive cases now well into the tens of thousands, and we haven't reached the peak of the pandemic in South Africa just yet. So what interventions will your department now be ramping up as we now are well into level 3 and we look to relax conditions even more?
Yes, good morning, Michelle, and good morning to the viewers. Yes, the country now is really bracing for one of the biggest epidemics that we've ever faced. So there's quite a lot of interventions that government is trying to implement for now. But firstly, we must just mention that the country so far has done very well. We've actually, the modelers have told us that this is where we're going to be getting as we're moving, even though we think we're getting there very fast now, with the Western Cape having reached its peak, and we're expecting the other provinces to actually pick up. So for us now, the quick issues is working on the prevention, community prevention in terms of transmission. For us, that's the most important, and there are many ways of doing that. But also the other critical part is actually the case finding, that is getting the people who are infected through testing, and then getting them quarantined so that they then don't spread the infection. So that is our critical aspects. But this now calls for the community to stand up, because let me tell you, the hospitals are not going to prevent the transmission. The transmission will be prevented in the communities through behavior change and through all the interventions. I mean, by behavior change, I mean issues like washing of hands, issues of self-isolation if you suspect something, social distancing, wearing of the face mask, cough etiquette or sneezing etiquette. So those are the issues that we are really pushing very hard for now, so that we are able to cope as a country.
Yeah. Dr. Buthelezi, how are we looking as a country just in terms of testing, first of all, the availability of testing kits and backlogs in results that are coming out? Are we clearing those backlogs?
We're moving, but firstly, I think I must just advise that the big issue that we're facing as a country is that we are competing with all the countries, because we've got very limited suppliers globally, and all the countries are actually competing for the same testing equipment. So what we've done as a country, we're moving, working hand in hand with the private sector and our own laboratory services, which is NHLS. We are starting to clear up the backlog. Specifically, we are focusing on the 2 provinces for now, which is the Western Cape, and they are doing very well to start address that, and then also the Eastern Cape, because it's the next province. So we are moving fast, but we are also in constant communication with the different manufacturers of the different testing equipment to ensure that we actually, the performance of the testing kits, they improve the efficiency on the ground. So we're working on that. But also, in addition, through our president, through our minister, and through the different interventions, there's negotiations globally that South Africa gets priority in terms of accessing those test kits. And I can tell you that we're moving very fast into that. And we hope actually within the next 2-3 weeks, where we should be par in terms of testing, once we get the stock that we think we're going to get in terms of the testing equipment. And we must thank our laboratory services for actually standing up and moving quicker, and also the private labs for collaborating with us.
So one way of dealing with this issue around testing kits, I suppose, coming from the Western Cape, it's decided not to test those under 55 without comorbidities. I mean, is that one way of dealing with the issue around the availability of kits? Are you leaving up that decision up to the provinces to decide how they institute testing?
Yeah, firstly, let's say as a country, yes, we are encouraging the provinces to now go for targeted testing. But let me go back a bit back and say, why did we have to do the mass testing all over the country that was announced by the president? You remember that initially the virus was actually an imported virus, affecting mainly the affluent communities that had traveled, but we were not sure how it's going to affect the vulnerable populations. Hence, we needed to understand what's happening on the ground. We did the mass testing just to see what's happening, so that we are actually able to plan and be ahead of the virus. So now we think we clearly understand in terms of hotspots. So we've actually saying the provinces must actually do now targeted testing, but each province must actually adapt and adjust according to its own context. The Western Cape, that's a context they've taken. KwaZulu-Natal might take the same context, but we've set up the basic principles at national with provinces to adapt accordingly. Yes, we are actually going for hotspots and actually for testing the vulnerable, which is we're looking for health workers, people with comorbidities. Those are the main people that we think we actually need to be testing.
And then, the recovery rate, if I look at the latest information coming from the Health Minister's Twitter page, 24,364 recoveries. Do you reckon that gives us some hope, DG? And, in time to come, we might see the recovery rate actually surpassing the number of infections?
Yes, actually we're very happy with the recovery rate, but for sure for now we will see that the recovery rate will still be below the infections. But as we start winning the war and ramping up our interventions, we will start to see that increasing above the new infections, and for us that's very good, and some information that we want to communicate to the communities to understand that people are recovering. And for us, we really need to ensure that we implement the necessary interventions for people to recover, especially the young ones, the ones with no comorbidities. Really, it's a self-limiting disease. And for us is to try and ensure that those, even if it's self-limiting, they then don't spread it to those who are vulnerable and with comorbidities and the elderly.
And then, a few weeks ago, you'll remember, DG, that, the minister and his team, he gave us a wide-ranging presentation on some of the models that were being used to track the kind of path we would see COVID-19 taking in South Africa. If we look back on those models now and where we are at this moment in the pandemic in our country, how much of that has changed and how much of what we saw the modeling data give us then is actually coming to fruition now?
Yes, one of the issues that we've just seen is that if you look at those models that predicted that by the end of May will be above 30,000 infections, actually that exactly happened. So the trajectory actually does agree with what was modeled. The only difference actually was on the geographic searches. We all thought that Gauteng was going to be the first, then KZ, and then Western Cape. But as we talk now, Western Cape has been the first to search. So it's only that part, but for us that's immaterial. We think that the models helped us to plan, and they are still helping us as we're moving forward. So they were spot on.
Yeah. DG, just before we let you go, very, very quickly, what a time for you to accept a new position. How are things going so far? How are you handling really hitting the ground running?
I don't think there's ever a good time to take a position in health, because we know we've got a quadruple burden of disease. But I must say, starting at this time, it gave me some comfort that I started when there is government that is giving leadership to the President, the National Command Council, our Minister of Health. So it's getting into the system that is well-oiled. Of course, we do have some challenges there and there. So I'm moving into a train that's moving in the right direction. So for me, is to see how I fit in and ensure that operationally on the ground, we all talk the same language.
Well, I'm sure we'll be talking to you quite soon here on the AM Report, and all the best to you. Thanks very much for your time. That's the newly appointed DG for Health. That's Dr. Sandile Buthelezi.